Have you ever had that nagging knee pain? You know the kind I'm talking about. The one that just refuses to go away no matter how much you ice it, stretch it, or try to strengthen the muscles around it. Well, if that sounds familiar, you're in the right place. We're about to explore a hidden cause of that pain that might just be the missing piece of the puzzle you've been looking for.
It is such a frustrating question, isn't it? You feel like you're doing everything right. You're addressing the joint, you're working the muscles, you're careful with the ligaments, but still, that pain just hangs around. So what gives? Well, the reason it's not getting better might be because the real problem isn't where you've been looking.
Exactly. We're all conditioned to think about bones, cartilage, muscles when our knee hurts. But what if the source of the pain is hiding in plain sight, in a system that we almost never associate with joint pain? What if it's your arteries?
That's right, your arteries. It sounds a little strange at first, I know, but today we're going to unpack this really fascinating connection between your vascular system and that stubborn knee pain. And honestly, this perspective could totally change the way you think about where pain comes from in your body.
You see, we tend to think of arteries as just simple pipes, right? Like flexible plumbing that carries blood around. But that's not the whole story. They're actually incredibly complex organs. They have layers and they're wrapped in this very sensitive connective tissue called fascia, which is full of nerve endings. And it's right there, in that sensitive wrapping, that the secret to chronic pain can often be found.
And this is where it really starts to make sense visually. On the left, you see just how intricate that network of arteries around the knee really is. It's like a complex highway system. Now look to the right. When there's a problem in that highway system, it can create these very specific, very painful tender points. You're literally seeing how a problem inside the body's plumbing can show up as a sore spot on the surface.
So, the big question is, how does an artery actually cause pain? Well, the mechanism has a pretty technical name, interstitial inflammatory stasis. Yeah, it's a mouthful, I know. But don't worry, the concept behind it is actually pretty straightforward. Let's break it down.
The best way to think about it is like a traffic jam, a biological traffic jam. Inflammation builds up in the tissue that's wrapped around the artery, creating a logjam. This logjam traps all these inflammatory chemicals, it restricts blood flow, and it basically starves the local tissue of oxygen. And that whole mess, that traffic jam of chemicals and oxygen deprivation, is what your nervous system screams out as deep, nagging pain.
So here's the play-by-play of how that jam happens. First, inflammatory chemicals called cytokines show up and put the artery's outer layer on high alert. It's like a warning signal. In response, the body sends in repair cells called fibroblasts. But here's the catch. Sometimes too many show up, causing the tissue to thicken up and choke off blood flow. And that leads to the final step, not enough oxygen, or hypoxia. This lack of oxygen really irritates the sensitive nerve fibers in the area, and that's what creates that classic burning pain signal. Okay, so now that we get the how, let's dive into the where. Because this inflammation doesn't just create random pain, it shows up in very specific, predictable spots called tender points. Think of this next part as us learning to read a map that can help us decode what your knee pain is really trying to tell you.
Let's start with a really common one. Right behind the knee, it's called the popo point, which is tied to the popliteal artery. If you have that deep, achy pain in the crease of your knee, and it feels like you just can't quite straighten your leg all the way, well, this specific arterial dysfunction could be the real reason why.
All right, now let's move to the upper inner side of the knee. Here we find the MSGA point. This one is connected to the medial superior genicular artery. So, if you've been told you have some knee degeneration or you're dealing with pain around your kneecap, what's known as patellofemoral dysfunction, there's a really good chance this little point is involved. And finally, what about that pain that feels like it's right on the front and center of your knee? For that, we often look to the DGAB point. It's located in that teardrop-shaped VMO muscle right above your kneecap and is linked to a branch of the descending genicular artery. Different pain location, different arterial point. See the pattern?
So identifying these points is one thing, but is there anything you can actually do about it? Absolutely. And that brings us to a specific hands-on approach designed to tackle this exact problem. It's called fascial counterstrain. Fascial counterstrain is this really gentle, hands-on therapy. The whole idea isn't to force a change, but to work with the body. A practitioner finds the fascia around the affected artery and uses these super subtle movements to release that deep-seated tension. The goal is to clear that inflammatory logjam we talked about, let the blood flow normally again, and basically convince the body that it's safe to let go of that protective guarding. The process itself is surprisingly simple. First, the practitioner finds that precise tender point. Then, they apply a very gentle glide to the tissue, which creates slack in the system, like taking the tension off a rope. They hold that position of ease for anywhere from 10 to 45 seconds, and that simple act sends a signal to the body's deep protective reflexes to just stand down. It allows the tissue to finally release its grip and reset itself.
Once you understand this connection between arteries and pain, it really does change the game. It forces you to zoom out and stop looking at the body as a bunch of separate parts. Instead, you start to see it for what it is, a deeply interconnected, holistic system.
And that leads us to probably the most important takeaway from all of this. Distant arterial tender points can cause proximal symptoms. Now, in plain English, what that means is that the root cause of your knee pain might not even be in your knee. The real problem could be an arterial issue further up your leg, or honestly, somewhere else in your body entirely. It's all connected.
So, I'll leave you with this thought. The next time you're dealing with a stubborn pain that just won't go away, ask yourself this question. Could the answer be hiding not in the muscle or the joint I've been focusing on, but in the intricate, vital network that powers it all? It's a whole new way of thinking, and it just might hold the key you've been searching for.